There's a whole bunch of types of arthritis. This video talks about the most common, gives you some basic information about them. I'm excited to share the information with you. Hello everyone, this is Dr. Jason West, and we're going to talk about arthritis, which is a condition describing inflammation of a joint. It applies to over 100 different symptoms, conditions, diseases that have been identified, and most of these diseases fall into one of two categories. They're basically degenerative arthritis, such as osteoarthritis, or inflammatory arthritis, such as rheumatoid arthritis. Symptoms of most types of arthritis include pain, stiffness, swelling, decreased range of motion. So we're going to talk about 11 or 12 of the main types of arthritis. And going in alphabetical order, let's talk about ankylosing spondylitis. Now, what this disease is it mainly affects the spine. It's when the ligaments fuse, and pain and stiffness are the primary symptoms. There is a blood test that you can do for it called HLA-B127. It's fairly specific and fairly reliable. There can be some false negatives and false positives. People usually have a lot of inflammation around their sacroiliac joint, and there's a lot of hypotheses on what this condition is caused from or started from. I think that you get microorganisms in the ligaments, and what happens is the ligaments, they get an inflammatory case, and then the body comes in to try and get rid of the problem inside the joint. The body comes in and tries to get rid of the infection that's in the ligaments. It gets scar tissue. Eventually the scar tissue turns into bone, and it's a very, very restrictive, limited type of arthritis. Now, the most important thing you can do about ankylosing spondylitis is, number one, move. If you stop moving, then what happens is those ligaments are going to fuse. And two, the other thing is, I believe that if you get an upregulation of your immune system, that you can get rid of the infection that's in the ligaments, and I think that you can turn around ankylosing spondylitis. The reason why I think that is because I've had several patient conditions and patient presentations that we've been able to do that. But for the most part, in traditional medical circles, they think that ankylosing spondylitis over time leads to a general fusion. Another type of arthritis is bursitis. It's an inflammation of the bursa, and this is not a type of arthritis, but it shares similar symptoms and may cause arthritis in some cases. Think about a little lubricating sac where you have this fluid container, and as it gets moved with the joint that moves, what happens is it squeezes and you get this little lubricating fluid that helps the tissues roll on each other or slide on each other like this. An inflammation of the bursa can be really painful. It restricts motion in the joint, and so it's not necessarily an arthritis, but it's closely associated with arthritis. Now, there's something called general arthritis. This is associated with overuse of the joint. It can be considered, quote, an old age arthritis, and that just means that the joint spaces are decreasing over time. Now, the neat thing about general arthritis is there's some amazing treatments that you can do that are not associated with over-the-counter. You can do over-the-counter medicines. It's not a prednisone deficiency disease. It's a funny thing that my dad would say, that you don't need this to live. You just need to stop eating inflammatory foods. And then there's some amazing treatment outcomes for general arthritis. There's some amazing treatment options available for general arthritis. My favorite one is regenerative injection therapy, which is either prolozone or prolotherapy or neural prolotherapy, which taps into the healing capabilities of the body by injecting building blocks, typically a vitamin, a homeopathic, sometimes a real mild pain reliever, and some type of inflammatory causing agent. Now, I want to be careful when I say that, because inflammatory causing agents, arthritis is based upon inflammation. It's just the wrong inflammation. If you put something in the body to stimulate it to heal, a lot of times you can get rid of arthritis. I have hundreds of video testimonials about that on our blog, dailydosevitamin-h.com, and there's some really neat alternatives and outcomes instead of just hammering people with nonsteroidal inflammatory or prednisone. And we've talked about regenerative injection therapy on other videos. Now, another common cause of arthritis is an inflammatory arthritis caused by the buildup of a uric acid in the joint called gout. And gout commonly affects the big toe, but it can do the foot, the knee, the elbow, the wrists, and the fingertips. Now, one of the biggest causes of gout is too much animal protein, too much acid, and too many purines in the body. Now what purines are is amino acid, and the amino acid is not completely broken down. It has a high concentration in pork products. So bacon, sausage, pork chops can really aggravate gout, and gout's no fun. It's like ground glass in the joint. Proteolytic enzymes decrease in animal products and increase in green plant-based foods, or almost a vegan diet, really helps with gout. There's a homeopathic called calcarea. There's another one called arnica, and some vitamin C mixed with baking soda. We call it sodium ascorbate IV therapy. Is amazing for gout. Gout also seems to be closely correlated with uric acid kidney stones, and anybody that's had kidney stones, I have had a set of kidney stones. It is no fun. That's something that you totally want to avoid. Another arthritic condition, it's an umbrella term, over 100 different childhood inflammatory autoimmune conditions, is called Juvenile Idiopathic Arthritis. There's Kawasaki disease, and there's juvenile fibromyalgia. And you just got to dig in on those different conditions, and you've got to figure out what is the cause and the contributing factor, and if you treat the cause, there's hope for those conditions. Now, osteoarthritis is a type of degenerative arthritis that's really common because what happens is the bones come closer together, so it's a bone arthritis. It's from the breakdown of cartilage in the joint. It can be from trauma or repetitive movements, and unfortunately it can be from aging. And so everything you can do to reduce inflammation in your body helps to spare you from osteoarthritis. And one of my favorite secrets for that, or clinical pearls, is raw cherries, raw pineapple, and omega-3 fatty acids really help significantly with osteoarthritis. Now, pseudogout, which is also called CPPD, type of inflammatory arthritis that occurs when calcium pyrophosphate crystals accumulate in the joint. It can affect any joint in the body, but it is most commonly found in the knee, and it responds really well to regenerative injection therapy. Psoriatic arthritis is a condition where psoriasis of the skin is linked to joint inflammation. Sometimes you'll see pitting nails, and it's the outermost joints of the extremities, and it's closely associated with skin conditions. What's happening in our skin is really a mirror of what's happening on the inside of us. Reactive arthritis is a type of arthritis that occurs as a reaction to an infection, and the condition often causes pain and inflammation in the joints and the eyes, and it can be related to skin problems, and it's almost always related to some type of chronic infection, a bacteria, a virus, and I like to make sure that we rule out Lyme disease for inflammatory arthritis. Rheumatoid arthritis is an autoimmune disorder where all of a sudden the body decides to attack the synovial fluid in the joints, leading to stiffness, pain, and possible deformities. The faster that you identify and treat rheumatoid arthritis, the better your options are for treatment. High-dose vitamin C therapy, ultraviolet therapy, UVRX therapy are all wonderful considerations for rheumatoid arthritis. Some of my best patient outcomes and favorite miracle stories are from rheumatoid arthritis. This is Dr. Jason West just going over some of the inflammatory arthritis, the metabolic, and the traumatic arthritises that occur in people. This is Dr. Jason West talking about the different types of arthritis. I'm excited to share with you the treatment options for those because there's some really neat, natural, non-invasive, non-toxic ways to take care of arthritis. We'll see you on the next video.